Adenomyosis is a common yet often overlooked gynecological condition that affects a significant number of women worldwide. It is characterized by the presence of endometrial tissue within the muscular wall of the uterus, leading to various clinical manifestations. Despite its prevalence, adenomyosis can be challenging to diagnose due to overlapping symptoms with other conditions. And its management options vary depending on the severity of symptoms and reproductive plans of the patient. This video aims to provide a comprehensive overview of adenomyosis, including its clinical features, diagnostic methods, difficulties in diagnosis, and available management options. Clinical features. Adenomyosis presents with a range of symptoms, which can vary in severity and frequency among affected individuals. Some common clinical features of adenomyosis include menstrual irregularities. Women with adenomyosis often experience heavy and prolonged menstrual bleeding, along with severe menstrual cramps, dysmenorrhea. This is due to the abnormal shedding and bleeding of the ectopic endometrial tissue. Pelvic pain. Adenomyosis can cause chronic pelvic pain, which may not be limited to the menstrual cycle. The pain can be localized or diffuse and may worsen during menstruation or sexual intercourse. Enlarged uterus. Adenomyosis can lead to an enlarged, boggy uterus. The increased size is a result of the thickening of the uterine wall due to the presence of ectopic endometrial tissue. Dyspareunia. Painful sexual intercourse, known as dyspareunia, can be a symptom of adenomyosis. The deep penetration during intercourse may exacerbate the pain caused by the presence of ectopic endometrial tissue. Bladder and bowel symptoms. In some cases, adenomyosis may cause urinary urgency, frequency, or pain during urination. It can also result in bowel symptoms such as constipation, bloating, and pain during bowel movements. Diagnosis. Diagnosing adenomyosis can be challenging due to the similarity of symptoms with other gynecological conditions such as endometriosis and fibroids. To establish an accurate diagnosis, healthcare providers employ various diagnostic methods, including medical history and physical examination. A detailed medical history, including a thorough discussion of symptoms, menstrual patterns, and pelvic examination, can provide valuable insights. The physical examination may reveal an enlarged, tender uterus. Transvaginal ultrasound, TVUS. TVUS is a commonly used imaging technique to assess the uterus. It can reveal characteristic findings of adenomyosis, such as a thickened and heterogeneous myometrium, myometrial cysts, and ill-defined borders between the endometrium and myometrium. Magnetic resonance imaging, MRI. MRI can provide more detailed images of the uterus and is considered the gold standard for diagnosing adenomyosis. It helps in differentiating adenomyosis from other conditions and assessing the extent and severity of the disease. Endometrial biopsy. While not a definitive diagnostic tool for adenomyosis, an endometrial biopsy may be performed to rule out other conditions with similar symptoms, such as endometrial hyperplasia or cancer. Difficulties in diagnosis. Several challenges may arise during the diagnosis of adenomyosis, leading to potential delays or misdiagnosis. These difficulties include overlapping symptoms. The symptoms of adenomyosis can mimic other gynecological conditions, such as endometriosis or fibroids. Distinguishing between these conditions solely based on symptoms can be challenging. Lack of awareness. Adenomyosis is often underdiagnosed or misdiagnosed due to a lack of awareness among healthcare professionals. This may result in a delay in seeking appropriate diagnostic tests or treatments. Imaging limitations. While imaging techniques like TVUS and MRI are valuable diagnostic tools, they may not always provide a definitive diagnosis. Small or diffuse lesions may be missed, leading to false negative results. Management options. The management of adenomyosis depends on various factors, including the severity of symptoms, desire for fertility, and the patient's overall health. Treatment options may include pain medication, over-the-counter pain relievers such as non-steroidal anti-inflammatory drugs, NSAIDs, can help alleviate menstrual cramps and pelvic pain associated with adenomyosis. Hormonal therapy. Hormonal medications, such as oral contraceptives, progestins, or gonadotropin-releasing hormone, GnRH, agonists, can help regulate menstrual bleeding and reduce symptoms. These therapies work by suppressing estrogen and inducing a pseudomenopausal state. Uterine artery embolization, UAE. UAE is a minimally invasive procedure that involves blocking the blood supply to the uterus, thereby reducing the symptoms of adenomyosis. It is a non-surgical alternative to hysterectomy. Hysterectomy. In severe cases or when fertility is no longer desired, a hysterectomy, removal of the uterus, may be recommended. Hysterectomy provides definitive relief from adenomyosis symptoms but eliminates the possibility of future pregnancy. Fertility-sparing surgery. For women desiring fertility, conservative surgical procedures such as adenomyomectomy, removal of adenomyotic lesions, or hysteroscopic resection of the endometrium may be considered. These procedures aim to alleviate symptoms while preserving the uterus. Conclusion. Adenomyosis is a prevalent gynecological condition characterized by the presence of endometrial tissue within the muscular wall of the uterus. The clinical features of adenomyosis can significantly impact a woman's quality of life. However, diagnosing adenomyosis can be challenging due to overlapping symptoms with other conditions and the limitations of available diagnostic tools. Management options for adenomyosis range from conservative measures to surgical interventions, depending on the severity of symptoms and the patient's reproductive goals. Increased awareness, improved diagnostic techniques, and individualized treatment approaches are crucial in effectively managing adenomyosis and improving the quality of life for affected women. Thanks for watching. Please subscribe to the channel.